Hey, good Tuesday afternoon to you folks. TJ Alt, I-45 now, Galveston now, and Clear Lake now, joined by Dr. Philip Keiser. He is the CEO of the Galveston County Health District, as well as Coastal Health and Wellness, and also our local health authority. That's the longest title ever of anyone out here, almost as long as mine. We took a break last week for Thanksgiving. Hopefully, you had a nice
Yeah,
Thanksgiving, Dr. Keiser.
yeah, it was great. We
And
had a great time.
and a safe one. I thought I'd kick off with that a little bit. Is that there was a lot of kind of wringing of the hands beforehand. Folks worried about holiday celebrations together or anything like that.
Hmm.
Do you expect then we may see a bit of a spike in COVID-19 cases here in the next couple of weeks or so?
Yeah, well,
Because folks were getting together for holidays again for the
yeah,
first time, really.
well, we're certainly on the lookout for it. Right now our cases are about as low as they have ever been. Probably September of last year, or maybe just at the middle of June, before we saw the Delta wave. So that's the good news. Our hospitalization rates are down again. Those are all the good news. But with everyone traveling, and just with our vaccination rates, we are concerned that we are going to see a spike. And if it does, it will probably start to see it in the next 2 to 3 weeks.
Which is kind of that time out there, and it'll be just in
Right,
time for Christmas, and then we'll see another one there.
right.
But I wonder, though, too, is that the vaccination rates in some parts of the country are lower. If we looked at Galveston County, of those that were eligible, mainly adults,
Hmm.
70%. It's somewhere around 66%, I think, when you take all now that
Yeah,
qualify
right,
in there, which is still pretty a pretty high percentage
right,
compared to some
right.
other counties in the state. Do you expect though there to be a better layer of protection as we move on at these times and being able not totally rid of anything, but just when these holidays come up, there's not as much hand wringing about it. If folks kind of go through the normal of keep social distance for people who don't know, wash your hands, those type of things, that can really keep it down.
Yeah, no, it can be, but I really think it depends on what people do and where they go. The real kicker with this viral spread are the super spreader events. Where a lot of people are together, and then one person can go through and just infect even hundreds of people. That's what happened at the White House. That's what happened in some of these church gatherings. That's what happened in some of these concerts and such. And so we are always on the lookout for that, and we're always worried about that, which is why we're still encouraging people to wear masks, and we're still encouraging people to get vaccinated. We're encouraging people to get their boosters. We really want people to go ahead and get boosted before Christmas. Because we know that there is going to be a lot of traveling and people are going to be moving around. And so, if you're eligible for a booster, and basically every adult who got their shot 6 months ago or longer is eligible for a booster, we would really encourage you to get it done before Christmas.
Something kind of interesting on when you talk about boosters. In fact, we are right off the bat. We have a question that's going to lead into our next series of questions here. Regina Haley asking, should we wait on the booster to see if the new vaccine needs to be developed to fight the new variant, meaning the Omicron
Right.
variant there? But you're still saying go ahead, get your booster now before Christmas
Yeah,
if you
don't
haven't
wait.
done so yet.
Don't wait. Here's the thing. These vaccines, they're not. It's not a yes or no or all or nothing phenomenon, right? And so even if some of these new variants come out which don't have the same, the vaccine is not as active against it. It's not zero. And so the higher levels of immunity you have, the better protected you'll be. And that's why we think it's important for everyone to get their booster shot.
So, and let's go ahead and get into that, talking about the Omicron variant. First up, before we show some data you provided over here, how concerned should we be, and is it more contagious than Delta? Fairly new right now, as far as what knowledge of that variant is. But the president came out yesterday and says we should be concerned but not frightened. I'm paraphrasing that a little bit, or should not panic is the actual term he used. What's your advice on this?
Yeah, don't panic till we tell you to panic. We're worried. I'll be very honest with you. Everybody in this field is worried, and we're worried because of the numbers of mutations that this has. It's a lot of them. And then the second thing that we're worried about is it seems, based on the preliminary data that we have already, that it does spread more rapidly. That's about all we know at this point. Now, with both of those, there's a lot of potential implications. So the fact that it has more mutations means that the antibodies that we all have from getting vaccinated or even having prior infection may, that's the key word, may not be enough to hold it in check. We're worried because we used a lot of the monoclonal antibodies, such as Regeneron and other antibodies for people who were infected to help keep them out of the hospital. Those may not work as well. The manufacturer already said that we're not sure if this is going to work as well with the Omicron virus. So there's a lot of unknowns. It's almost certainly already in the United States. And we know it's in Canada, we know it's in the continent, and we know there are multiple cases there. The Commissioner of Health of New York City actually said that we believe it's here, and we believe we'll find it in the next couple of days. The good news, if I can put it in that respect, is because there are so many mutations with this, it doesn't require special testing to identify. So with just the normal swab test, it is possible now to identify the Omicron variant of this virus, and we'll know it much more rapidly and be able to track it much more easily than we've been able to do with the other viruses, where we get the swab test is positive, we send it off to a different lab, to a research lab, where they actually do very complicated sequencing and DNA fingerprinting to identify it for us. So that means we'll have some answers a lot more quickly, I think, than we did, say, with Delta virus.
You touched on this a little bit on that, is that will the current vaccines that are available provide some protection there, and boosters,
Right.
the way to look at it. And you're saying, yeah, it's not going to be zero. We just don't know how much of a protection it would be from there. Is that right?
Yeah, that's right. I mean, we think it's going to be less, maybe. I mean, again, there's a lot we don't know about this, and we think it's going to be less. But that's just based on the numbers of mutations and where those mutations are. And so, the scientists that are really good at looking at antibodies and DNA fingerprints, they look at it and they shake their head and they say, I can't imagine that the antibodies that are currently available, either through immunity or through a given IV, are going to be as effective, are going to hold on to this protein. Remember, so here's the spike protein and the antibodies bind to it. So, if the spike protein is changed enough, the antibodies can't grab on. And so that's the concern, is it's different enough that the antibodies can't grab on, and they can't grab on as tightly. And so if they can't grab on as tightly, that means that someone who's vaccinated may not be as protected. But just because it can't grab on as tightly, if you still have lots and lots of antibodies, it still can protect you. So that's the rationale behind, at least right now, with the recommendation that get your booster before Christmas. Just go ahead and do it. You're going to be with family. You want to go out on New Year's, just get your booster, and we'll see what happens with this. I certainly would not delay getting a shot because something new might come along.
And speaking of which, we're taking a look. This is a chart you provided to us before we went on the air today, and talk about what this is showing us here. It obviously that red line, that's going to be the Omicron variant that we're looking at. Delta's the blue line, and the Beta, which is the first variant.
That's right.
that really took hold in the U.S. Of COVID-19. So tell us what this chart's really kind of telling us here as we look at this.
So what you're seeing along the bottom is days since emergence, meaning since they first found it, and it shows you how rapidly it sort of picked up. And what you can see is this is the Beta, so it came and it actually spread kind of slowly. Delta was interesting because if you look at that blue line, you look at, say, like the 25 days. We knew that Delta was in our community back in April, and we were watching it. We knew we had, a few cases here and there, and we saw it slowly increasing. But when it got to be about 10%, it just started taking off, as you see, where it picks up much more rapidly. The thing that's a concern with this South African variant, or the Omicron, is that look how fast it goes straight up. It looks like a rocket going up, and what that suggests, doesn't prove, but that suggests it is more infectious. Now, there are lots of caveats with this, right? So this is very preliminary data. Basically, the way this all happened, it wasn't like they were tracking this and they saw it go up. What happened was they saw a spike in cases. And so then they turned around and they tested it and they realized, oh my goodness, this is something different. This is a very different virus. And this would explain why we're seeing these cases spike so rapidly. That's possible, but it could be possible that their days since emergence is wrong, right? It
Right.
could be that it had been around for a very, very long time and just slowly had gotten up there, and they were tracking the sort of the tail end of the rise. That being said, as we get into the European countries, where we're already seeing it in widely in Europe, and it's beginning to pop up in Canada. We'll be able to track it much more quickly as it gets into North America.
How about also too is, and you were talking about with the orange areas that you see on your screen now, folks, are the areas what we call, I guess you call them the Omicron
Hmm.
hotspots. And thanks to
Yeah.
the New York Times for providing this, shows Canada, shows southern parts of Africa,
Hmm.
parts of Europe,
Hmm.
there, Australia, and also, by the way, should point out some of the Pacific Isles, and but one of the things I was reading on across the board, there seems to be concerns, and some WHO officials said this too, is that the lack of of vaccines in a lot of other countries right
Right.
now,
Right.
and the lower rates that may be a contributor to one the quick rise
Yes.
of this, making it
Sure.
more contagious,
Sure.
and also the variant itself.
That's right.
Can you touch on that some?
Yeah, sure. So obviously, if it's, think of it as a fire, right? If there's a lot of dry tinder around, the fire is going to spread a lot more rapidly. And, we certainly see this out west with all these wildfires that, when that they just spread so fast. Think of the dry tinder as people that are not vaccinated or people that don't have immunity. So the more people that don't have immunity, the more rapidly it can spread. That's number one. But there's also this idea of what we call an escape mechanism, that the virus is constantly mutating and it wants to get away from the things that hold it down. So if you have a few people that are vaccinated and a lot of people that aren't, as it gets into those few that are vaccinated, it's going to develop mutations. And as it goes back and forth between the people that are vaccinated and the people that are unvaccinated, it develops more and more mutations. And so places where they have some vaccination, but not a lot, i.e. South Africa, would be a really good place for this to spread very, very rapidly.
And I wanted to kind of touch a little bit more, go a little bit deeper on this, because something you had said there is that as it goes between someone who's vaccinated and
Yeah.
unvaccinated, when
Yeah.
that's been said in the past, folks have said, well, the variants or the mutations come from vaccinated people. That's not what that means, does it? Or
Well, it kind of does, right?
okay,
So it kind of escapes, but so there's, how do we put this? There's this concept of fitness, and a virus is more fit. And if you think of someone who's physically fit, there's doing an obstacle course. Obviously, someone who's physically fit, can climb ropes and jump over things, and and so, some old geezer like me, I'm going to just go look and laugh and say, no way, right? But as we know from military recruits, they train them and they get more fit and they're more fit. Initially, they can't do it, but by the end of their boot camp, they can. And so by having these challenges of the virus is in somebody who's been vaccinated, and then it develops a mutation, it keeps that mutation. All right. And then when it goes to, it may not be in my nose for a long time. It may not grow to very high levels, but it may go to someone else who doesn't have any vaccine, and then it's going to grow very rapidly. Okay. And then it goes into someone else, and then it gets that pressure again. And then it's going to develop another mutation. And so that ping ponging back and forth actually is one of the scenarios where you have enough pressure to cause the virus to change, but not enough to really completely suppress it. That's where you tend to see the highest rates of mutations. And that's where you tend to see with those mutations, some of those mutations don't do the virus any good. Some of it do it a lot of good so that it can replicate more rapidly. And so when you
and
get accumulation of those things that do a lot of good, that's when you get these
and maybe where people can get an idea of this is that every season you got to kind of figure out what the flu
Absolutely.
is. And
Absolutely.
so the shots or the flu vaccines that folks get are adapted in some ways to do a better job of fighting,
Hmm.
the flu strain is the term that's used a lot of things, but essentially a flu strain is a variant. I
Right.
mean, it's just a different way of saying it.
Right.
And so is it in similar ways of that is that as you make vaccines that learn how to fight something at the same time, the virus itself is always trying to find a way to survive and
That's right.
find a host, thus the term
That's
that
right.
it's a virus, that
That's right.
it's
And it's always trying to keep itself alive and propagate itself by whatever means it can.
And so that's something to know for folks. I just as we look at things as it comes here, how long until we know, for example, on Omicron, how long do we know how dangerous? Maybe dangerous is pushing it too much, but let's just say
I think that's a good question. I
how
think it's
how dangerous
yeah,
this is going to be. Because there's
yeah.
one thing about it being more contagious. It's how sick do you get,
That's
uh,
right.
where it comes down to. It's one thing if you get something, it's on there, um, and that goes to the question that Aaron Kristen had just asked: do we know have these cases in South Africa been mild or severe? Have their hospitalizations gone up significantly?
Yeah. So
Uh,
so in South Africa, their hospitalizations have gone up. But keep in mind, South Africa has less of a uniform healthcare system than what we have in the United States. And so, you can go to Johannesburg and they have wonderful first world hospitals. I mean, that's where they performed the first heart transplant was in Cape Town. But if you go out into the rural areas, they don't have the same type of support there. So it's hard to make those um, determinations based solely on South Africa. Now, in Israel, they're already reporting that they're seeing cases of Omicron, but the cases tend to be mild in people that are vaccinated. So again, that's good news. How will we know? Well, we're going to have to see several things. One, we're going to see a spike, okay, which we may very well see. We know with people traveling, this thing is coming into the United States just at the right time to really spread widely with Christmas and New Year's coming. And then with that, we'll have to have enough cases to see, are we seeing more people getting hospitalized and are we seeing more people dying than we would usually see? And we've got a pretty good idea of what we can expect at this point on both of those. So, when do we expect to see that happen? I think we'll have a much better idea sometime around Christmas and the New Year's whether this thing is taking off. And I think sometime mid-January we'll have a better idea of whether if it is taking off, if it is more dangerous.
I'm kind of adjusting the screen here just to kind of show, just so that we can give some folks some perspective. The South African, you talked about the healthcare system,
Yeah,
vaccination rate is less than 25%.
right.
Whereas
That's
in the
right.
U.S., it hovers between that 60 to 55 to 60% there. So that's the criteria that you're kind of looking at. But where the milder cases have been those who have been vaccinated. So they said that's what's given some confidence that if you have any of the vaccines right now, that you're better off. That
Yeah.
in fighting that at this point
Hmm.
in there, and that goes into the other question is what age is the majority of this variant are you seeing? Are we seeing it older groups, middle age groups, younger adults,
Yeah. Again, we
children?
don't know a lot, but what we've heard so far is that it is affecting the traditional risk groups more badly. So more elderly people, people that are immune compromised, people that are unvaccinated, and
Which
particularly people in those groups, which is what we would expect.
would expect, right? I mean, on
Yeah.
anything that would spread, that's kind
Right.
of the way you look at it to go along that lines. But again, your recommendation on vaccinations and boosters right now.
Yeah, get boosted, and I would do it before Christmas. Get it that way you don't have to worry about it. We know that there are over 100,000 people in Galveston who have gotten vaccinated who haven't gotten their booster yet. Okay. CDC came out yesterday and said everybody over 18 should get a booster. Okay. So just go ahead and do it. We got plenty of vaccine. It's widely available all over the county. It'll be easy to get your booster. It's just one additional shot, and you can feel a little better about visiting your family during the holidays.
And you bring up something there that I had not asked you more specific about is the CDC recommendation,
Hmm.
which we've talked about here. You've thought it's been kind of slow in coming,
Right.
uh, saying that that go ahead, everybody,
Yeah.
and if you're 18 plus, go ahead and you can go and get the booster. It doesn't have to be it does not have to be necessarily a high risk category or anything like
Right.
that. I wonder though is that how many folks were really strictly following that in the long. You've said it yourself that if someone comes in and says I'm a high risk category, you're not making them prove it at the
No.
health district or at UTMB
Right.
at this point,
Right.
right?
Right,
And
right. I mean, we take people's word for it. I mean, imagine the situation if somebody really was high risk, and we go, I don't know, you don't look that bad to me, right? And then they
right,
turn around and they get a bad case of COVID. I mean, that would be awful. So we take people's word for it, and if people have any questions, we're happy to talk to them about it, and or talk to your doctor or healthcare professional about it. But the recommendations out there, I think it's been a long time coming, and it's time. Just go ahead and do it. My own kids have been putting it off now, and so it's sort of like, okay, now's the time. If you're
right.
coming for Christmas, don't come unvaccinated, don't come unboosted.
Right. All right. Now, in fact, our next thing we'll be talking about is that we've talked about uh, the vaccines and the like. We've heard some good words about Merck and also Pfizer having an antiviral
Yeah,
pill. As you and I are talking right now, and I'll bring it up on screen. The FDA is meeting as we are having our session here, and they're meeting remotely. Their advisory committee is on the Merck
right.
antiviral pill. Now, a bit of news came out on that is that when Merck first announced it, it said its studies had shown that it was about almost 90% effective,
Hmm.
uh, and now it's showing it's closer to 50 when they have more data in.
Right.
And now that would seem like that's not good. That's actually in the world of viruses and the like. Isn't that actually pretty good though?
Oh, it's really damn good.
I mean,
If
it's
we had a flu pill that was that good, we'd be delighted.
right,
So keep in mind that also a lot of the effectiveness of these drugs really is determined by who you let into this study, right? So if you're looking at sick people and you can reduce something by 90%, hey, that's great. But if you're looking at a whole bunch of people who are not likely to have a bad outcome anyway, right? A bunch of 20-year-olds who are probably healthy who are going to do well, seeing a 50% reduction is pretty good. So we're very anxious to get these pills. And we're anxious to get these pills because we need more tools in our armamentarium. And so Merck has these, Pfizer has some, which are probably, maybe 3-4 weeks behind Merck's. And if we end up having another surge, particularly with Omicron, I think it's going to be very important to have other means of treating people. And in fact, you can even envision some sorts of treatment cascades where we treat people initially with oral medication, and then, depending on how the monoclonal antibodies look with Omicron, then treating with Omicron, and then that's going to the drugs for people that are more severely ill. We're going to have to wait and see, and we're going to have to see how all these drugs work and how they stack up against each other. And that's just going to take time. But we would really like to have them. I think instead of having to refer you to a hospital to get an infusion or to get 4 shots for a monoclonal antibody, it'd be just much easier if I could, excuse my Diet Coke, if I could just go, here, take this, you know,
right.
and it would just make life a lot easier, and I think we'd see a lot less spread of the virus.
And that in many ways is we've talked about this a couple of times now that this is a game changer that we've gone from vaccines to actually talking about a pill
Yeah,
in well 2 different pills really at this point aimed at the same thing that the progression of how we've gone from point A to this is tremendous to begin with.
Hmm.
Although and I will warn everyone, I've been watching this, since it started at around 8 o'clock our time today. It is not the most riveting discussion you're going to find anywhere right now. That's why you don't have the audio on here, folks. This is a lot of scientists talking here and writing out answers, as well as, yeah, that's what you're seeing in the bottom right hand screen. You'll hear a voice, and then you see it typed in as well, so that folks can who are hard of hearing can see it. Um, but anyway, and so these are predetermined questions they're asking Merck officials about, and Merck's scientists about, to get that. But that's going on now. We expect Pfizer to go for the panel, I think, in 2 weeks, right before Christmas. I think it
Yeah,
was.
it's they're 2 to 3 weeks behind Merck in terms of when they filed. So it really depends on when all the paperwork's done and when they're ready to go. But I would think that the FDA would want to get this knocked out before the holidays rather than waiting until after the holidays, because that would be another 2 week delay.
Let's get a quick update. The youth vaccines. I had a cute moment yesterday. I got to tell you, it was really kind of neat. I was walking into a convenience store to grab some water yesterday, and there was this family who was coming behind me. I was holding the door open to them, and there was a father and his two young daughters, and they
Hmm.
had their mask on actually as they were coming in the store. And the dad asked me, and he said, thanked me for opening the door. But then he said, I said, great, how's your day going? And one of the young ladies says, our day's great. We just got our second shot. I said,
Good.
well, congratulations. She was so excited
Yeah.
about that. And I was like, okay. I mean, I wasn't soliciting anything from him, but then she was proud of that she had gone out and done this.
Yeah.
Just so you had said, when we first talked about this, about the week after, because right now, right after Thanksgiving, because I remember hearing that day I was hanging out with the Cohens over at Dr. Hayes's office in Texas City, and over at UTMB's primary care clinic and pediatrics clinic in Galveston with the families that were getting the vaccines those days with their children. They were all being told, okay, day after Thanksgiving, you can come and get your second shot.
Hmm.
And so it was around this time for all of them to come in
Yeah.
and do so.
Yeah.
What are the rates you're seeing with the younger kids now that are
Yeah,
getting
it's
vaccinated?
it's it's slow but steady. We're 3 weeks in now. We've done a little over 4,000. As of, I don't know, yesterday morning was the official tally. We are seeing some delays in the states reporting of it, so we think it's a little bit higher than that. So it started off, I think our first week was less than 1,000, and then the second week we did like about 1,800 or so, and now we're about 4,000. So it's coming along. There are about 20 to 25,000 kids in that age group in the county that are eligible.
Hmm.
And looking back at the data on the 12 to 18-year-olds, it had a similar type of uptake. It wasn't, we were expecting a big rush, and it didn't happen, and we were all disappointed. We were kind of expecting, another Walter Hall Park. Um, but at this point, we're well over 50%, close to 60% in that age group, and I think we're seeing the same thing with the younger kids, and I think it's just going to take time.
I wonder though too is I and we've talked about this every time this subject's come up in any way here, is that folks are really more concerned about doing something with their kids than they are themselves
Absolutely.
on a vaccine thing. That every not every, but most adults that I've spoken with on this, even those who themselves are personally pro-vaccine, when you ask them about their own kids, they said, "Well, that I may wait on,"
Yep.
which I totally understand. I wouldn't I wouldn't question
Total.
someone
I
who
mean,
takes that approach on it.
we are totally seeing that, and it's interesting. It's not even their kids. It also depends on how old their kids are.
Hmm.
So if they have a 14-year-old, they get the 14-year-old vaccinated, but their 6-year-old, I don't know, not my babies. I mean, and they're worried about it, and they just want to kind of take their time and think about it. But I think it's slowly but surely working its way through. And again, the more people we can get vaccinated, the better off we'll all be. The less disease we'll see, the less severe disease we'll see, and we can continue heading back toward normality.
Yeah, it is. I said it's a little bit different as you're looking at the young Cohen boy. By the way, and congratulations to his dad, Rabbi Cohen Galveston. He's heading home to Ohio. He announced
Hmm.
last week too. I should point out, leaving the island
Oh,
for that. And Aiden Cohen, he was proud to show off
yeah,
his vaccine card there, and he was one of those. They were going to travel over the Thanksgiving holidays, and they
yeah.
just got back. And this is one of the reasons that they had done so. And Aiden was one of those. He was like those little. The moment that little girl said how proud she was of that second
Hmm.
shot, as I said, unsolicited, it reminded me of dealing with Aiden Cohen that day, because
Yeah.
that kid was super excited, mainly because he likes to play the guitar
Hmm.
for the public, and he likes to get out to the public.
Uh-huh. Yeah.
Uh, and and I half expected to see him at the Hanukkah celebration in downtown Galveston tomorrow
Mhm.
as well, for the fourth night of Hanukkah, coming in there. So and so on the kids, right? As I said, there's some hesitancy
Mhm.
on that. But I think it's almost as we kind of expected, that not as maybe as slow, but that you said it's been steady, which may be a better thing than a rush, like you said, a Walter Hall thing.
Yeah. Well, it certainly makes our lives easier, right?
Yeah.
And and but we would just encourage people to continue to do it. And so far, so good. We haven't had any reports of any of the kids having any problems so
Well,
far.
and we'd be remiss not to bring up, kind of a negative side of this. When you tried to do something of more of a clinical side to open it up to folks, and did so in Friendswood, protesters
Yeah.
showed up
Yeah.
there. Nothing wrong with protesters, but
Right.
these protesters went a little bit over the line in that they were yelling at kids
Yeah.
going in. It's one
Yeah.
thing that you're holding a sign or something like that, but yelling at kids as they were going in, and yelling at their parents and calling them names. And that's one of the things that's prompted the health district to do so. If you do a community thing, has that incident in Friendswood though brought about a kind of a rethink of this? Like, let's just stay with the clinical setups where folks can just come to their primary
No,
care physician or
we're
the like.
we're really looking at the numbers and the demand, and we're also looking at places where at accessibility. Keep in mind that there are lots of reasons why parents haven't gotten their kids vaccinated, not the least of which is that they work. And so having them come during regular clinical hours can be quite difficult for them. Although most parents say they prefer to get their child vaccinated in their pediatrician's office. But when we have these things, we have parents show up on Saturdays and on after hours. We have parents show up, and so we do feel like that's a very important thing to do.
Part of that though too is, and I need to stress to folks, this is free. I mean, you don't have
Yeah,
to pay for the vaccine.
yeah,
And I had well, actually three different parents who contacted us by private message and says, where can I go to one of the clinics? And are they going to do something like at Walter Hall? And I said, well, no. I said, there'll be a couple of these community vaccinations, but you can just call your doctor or
right,
or call the health district. And do it. Says, well, no, I don't want to have to pay.
right.
And I explained to them, no, it's free no matter what. You should not be charged at
Yeah.
all
Well,
to get
some
the
people are,
vaccine. Yeah,
unfortunately.
there
I'm,
are no. That's what I'm saying. There are some folks, and I will call them right now, out unscrupulous,
yeah,
who are charging people
yeah,
for a visit.
right,
They're not supposed to do that, but
right.
they are. But the Galveston County Health District has, its regular clinic open for the vaccines.
Hmm.
UTMB, yeah, and as I recall, too, you don't have to be an actual patient of UTMB to get in through one of the pediatrics. They'll just put you in the system. Do
Right.
it may take a
That's
little
right.
bit longer, but you don't have to be a current patient with them.
That's correct.
And so if cost is the thing, it's supposed to be free. And you can go to, and the good thing is too, you can go to a Walgreens or CVS pharmacy, local
Yeah.
pharmacy as well, and most of those will have that
Yeah. The,
for
the,
you
the,
along the
the
way.
federal rule says that you can ask for, but cannot demand an administration fee.
Right,
Right
right.
now, so it's like 15, $20, right? And so for people that have that, I'm sure a lot of the health systems that are doing this are grateful for it because it costs money and costs time and effort to do it. We don't
It
do that
does.
in the county, but on the other hand, if you say that $15, I'll have $15. The answer should be okay, no problem.
Yeah, and go ahead and take care of no pressure
Right,
tactics
right.
on there. Another thing I was going to ask about, the last time you and I did this show, I was a little bit under the weather and told folks because I was sounding raspy, and I was waiting back actually for my COVID test to come in. One of the things and by the way, it was negative, as I said, and it was
Mhm.
negative for flu too. So it was kind of a weird thing. My doc said that was probably I was on the tail end of it, but one of the things that I was talking about, I said, just in case this does turn out to be COVID. I have been doing a lot of reading on monoclonal antibodies,
Mhm.
and I wonder because we talked about the antiviral pills from Merck and Pfizer.
Mhm.
Why are we outside of a few commercials I see every once in a while on a national basis of asking,
Mhm.
why are we not seeing more of this pushed?
Well, well, I'll tell you, in July, we were pushing it like crazy. Um,
Right.
but it's a couple things, I think. First of all, again, there are administration fees and costs with that, and again, people can ask for, but not require you to have it. But it's not cheap. I mean, you go get an IV infusion, it costs the hospital about $500 every time that's done. Okay. So there's that issue, but there's also, interestingly, we ran into a scenario where the state was concerned that we were quote unquote overusing it and wanted to make sure that we were following the guidelines. And of course, these guidelines they're very loosely written and they're open to a lot of interpretation. And our philosophy has always been is we want these things to be as widely applicable as possible. Now, if even if someone has mild disease and you get a monoclonal antibody, what that does is that actually reduces the amount of virus in your nose, which from a medical point of view may not help you that much, right? Okay, because you're not that sick and. But on the other hand, it helps the other people around you because then you're not spreading that virus. So from a public health point of view, it makes a lot of sense to get as many people treated with the monoclonal antibodies as possible. We did run up against a shortage where at one point we thought that we would have limited amounts and that the amount that we had would be limited. That actually never came to fruition. But we were always ordering ahead of the curve, so that way when it came time that they started to restrict things, we had plenty on hand, and then we were able to use up that reserve, so we had plenty. And then that surge fell off, so there wasn't as much demand for it. It's interesting. You look at the past week or so, we've had an uptick in demand for the monoclonal antibody, and
I think that some folks are a little more comfortable going that route too.
yeah.
As I said, I was one of those who said if this comes back positive, because I know I was having mild, I was early on, I'm going to ask for it because of the
Oh,
research I've done on it, and it's
if it came
uh,
back positive, TJ, no problem. We'll get you in.
yeah, I know. Well, I know I'd get in there, and then by the way, I don't get into the front of the line all the time
No,
on those
and you
things.
know what?
People said that to me, and I was like, no, no, I just want to make sure they understand. I'm like anyone else. I'll get in if I want it, and
But you
that's
know what? It's really interesting. We have people who kind of think that people are calling up and using privilege and things and being manipulative, and that actually isn't the case. It's just kind of it's guiding people through the process so that they can get taken care of as quickly as possible. And we made an agreement back in June that the UTMB would do most of the monoclonal antibodies. Health district would focus on the vaccinations, and we kind of divided up that division of labor. And I'll tell you, UTMB really stood up on that. And I know the nurses that were running this, and the amount of, if we gave out medals for COVID, they would get the Medal of Honor for the work that they've
right.
done in getting this stuff set up and very conscientiously getting people in. All it would take, so there was somebody who's having a hard time getting in or having, and I get calls like this all the time, and some of them, are people, who you think are important. Some of them are people who just get my cell phone number. I don't know where they get it, and we treat them all the same, and you just make a call or two and say, hey, look, I got this guy needs to get in. Can you help him out? And it's like, don't worry, we'll take care of it. And so the attitude is not one of keep people at bay. The one is let's get people in and get people taken care of as quickly as possible.
One of the things we haven't had a chance you and I to talk about on the record here, in that the case of Caylee Cook,
Mm-hmm.
who sadly had passed away.
So
And at first indicated it was COVID. Then
yeah,
then when folks started raising up that a 4-year-old should not die
right,
from COVID-19, particularly how this case worked out. And then finally, the medical examiner came back and said that was undetermined.
right.
Um, and one of the things I wanted to give you a chance from your end, and forgive me the barking in the background. I am working from the home office today, and there's some yard folks here. But I want to give you a chance to do too, because the formal announcement, did
Yeah,
come from the health district
right.
originally. If you can walk us through the process now of how will those be handled in the future?
Yeah.
Folks who
So
watched this know they
right. So
heard the
let's
interview with Dr. Erin Barnhart, the medical examiner. She has said they're going to tighten up their procedures
right.
on what would be what's called an unattended death of someone who dies with COVID, which is they've
Right.
tested positive, of what goes into that process now, which is very few, by the way,
Right.
of those that are not monitored. But I wonder what's going to change. Do you think on your end? I know you've asked for some changes on y'all's updated on the procedures.
Yeah. So so basically, we heard about this through the grapevine, quite frankly. And I think from the school system was the initial place that we'd heard about her death. And so we began investigating, and one of our investigators called up the medical examiner and was like, "We heard you had a 4-year-old who died from COVID." And it's like, "Yeah, that 4-year-old died from COVID." And so we started trading information, going back and forth. Young girl, was 4 years old. Family was there was COVID in the family, and she died over Labor Day weekend. And we went back and confirmed with the medical examiner's office, not talking to the medical examiner herself, but just talking to the people in the office. This child died from COVID, right? You had a positive test, right? Definitely. And then it started hitting, Facebook. It started hitting, a lot of other social media things, and then actually press was calling us up and asking about it. So, we issued a preliminary statement, and was if you look at it, I'm not trying to sound defensive, but at the time we were trying to make sure we covered our bases, and we say, that there is a 4-year-old and it died, and we're not going to include her in our count until we get more information. We need to know more about it. And then at some point, I'd been trying to get a hold of the medical examiner, and unfortunately, we crossed paths right after we issued our release. And so after discussing the case, we both decided the best thing to do would be to do a full autopsy on the child. My understanding of their procedures was that they had these things that had actually started early on with COVID, when before people were vaccinated and before we had good infection control practices about that they would test bodies and see whether they had COVID in terms of the in their nose, and then if they had COVID, then not do an autopsy unless there was some suspicion of foul play or something else. And part of that had to do with the fact that they had to be done in a specialized facility with a lot of special precautions. And again, my understanding of what's going to happen in the future is that they're going to look at these cases more closely and not just release a body based on a positive COVID test. That they're going to really investigate it a little bit more. So.
Right, and that's something that and obviously that data goes back to the state, data goes back to the health district, and
Right.
y'all actually have the authority to report this. That's where it comes from on
Right.
those type of
Right.
things. But
Right.
obviously, a case like this was made international news.
Yeah.
And we should point out, I mean, you said you were getting calls from the media. Yeah, I was one of them right off the bat. That was
Yeah.
like
Yeah.
when the school district, and I should point out that's a school district, but a school principal announced it online.
Okay.
That's where we saw it, and that's when we started asking questions ourselves. And
Mm-hmm.
I was asking about this, hey, is this true or not? And I
Right.
will, I need to give some folks some explanation here. It was 2 days before that statement, from when I asked a question to when this statement went out. So it wasn't like it was a knee jerk reaction. I mean, it was like, hey,
Mm-hmm.
we're checking into it. We were talking about it to find out. So I think it's important there. But it goes into what a bigger issue, and you and I've talked about in the show, of that is one case. It would be looked as an outlier in many ways, but it
Mm-hmm.
did expose what to me would be a concern of a bigger issue,
Mm-hmm.
although not a huge issue. Very few people who have been classified as dying of COVID, not with COVID, but of COVID, of a
Mm-hmm.
COVID complication, very few of them have been unattended and not being treated for COVID at the time.
That's absolutely correct. Most of
Right.
them are, in fact, what we typically do for us is that when someone dies from COVID, we usually are informed by the hospital, and when that happens, we get their medical records, and so our investigators will actually look through the medical record of the individual, determine what their age are, whether they had complications, whether we really do think this is a COVID related death. Obviously, we rely on what the physicians tell us. And in most cases, they are. In fact, most cases are people that have been hospitalized for quite a long time. And so there really is no question about what's going on. Nevertheless, we still do our due diligence in doing this. And I think the lesson learned from Caylee Cook is that 4-year-olds don't die from COVID. Right.
Right.
So the thing is that
Or shouldn't. There may come up. Right.
Right. So we do know. So just to make sure everybody understands, she did in fact have COVID.
Right. Died with COVID is the actual.
Right. Exactly. Right. That's correct. So, but did not die of COVID.
Right.
And what that cause of death is, remains undetermined. She had a history of febrile seizures. It's possible that the COVID had given her fever, and then she had a seizure and died in her sleep from the seizure. But of course, without having someone there witnessing that or telling us about that, that's a very, very hard call to make.
And I should point out too, while we've clarified that, we also clarified, I know in our reporting, but there was also no foul play found. That's
correct.
An undetermined death, and I think
correct.
Many people, they want to blame the media on this. Not once did we ever report that it was a suspicious death as far as foul play was concerned. The sheriff's office never thought it was.
Right.
But they investigated as they're supposed to do
Right.
in those cases, and CPS gets called in as they're supposed to do.
Right.
And then when this came out, the DA announced, "Hey, this has been looked at. We're not going to pursue anything." So there was no criminal act, and there's obviously no COVID. It's an undetermined death. So I just wanted, that's kind of the loose end. We have not been able to talk since since the last time you and I talked about COVID related issues on this show. Anyway, so again, the official cause is undetermined cause of death, and
that's right.
Unfortunate. And our prayers still go out to. I've talked to Miss Harwood via text many times, and just have stressed to her and Kaylee's father, our prayers are with them. And it's tough to lose a child, but to lose a child in such a public way too, and everyone was sick in the house too, right. And so there was a lot of things that went into that. But I wanted to make sure that was stressed here, so we understand it more of a context than just kind of a straight up news reporting on that. Again, if you have any questions you want us to ask Dr. Keiser, we'd be more glad to do so. I had one of our viewers through the week wanted me to ask you this for sure. At some point, does what we do now, the 2-shot regimen on the vaccines, become, now since we have the booster, does it now have to become routine to do a 3-shot regimen?
Maybe 4-shot.
4-shot.
So when did I get my booster? I don't know, October. So I'm counting, right? And I think a lot of other people are too. And so we're really going to have to see what that 3rd shot does over time and how much protection it adds to it. So it would not surprise me if this turns into a 2 or 3 shot induction followed by a yearly shot. Typically once you get immunity up to a certain level, you don't need as much to keep it up there over time, but that wouldn't surprise me at all.
Dr. Philip Keiser, the CEO of the Galveston County Health District, Coastal Health and Wellness, and also the local health authority, has been on with us as he does on a regular basis. We'll be back again next week to talk more about this. We'll be following the Omicron variant as that will be one of the things that we'll be tracking, I know, for a while, as folks have a lot of questions about that, and as we get into the Christmas season as well. So again, if you have any questions you want us to ask on the show, feel free to email us at news@i45now.com, or you can send them to us through our page here as well. Dr. Keiser, thank you very much for coming on. Good to see you again, and have a good, like the bow tie, by the way.
Oh, thank you. I tied it myself.
You tied it yourself. You're 20 steps ahead of me then, because I can get it where I look like the end of the night, but I can never get the part that looks at the beginning of the night with a
Yeah.
bow tie.
When I lived up in the Northeast, when I was in Baltimore, I would wear a bow tie every day, and I got to the point where I could tie without even looking at it. I got to admit, I had to look in the mirror to do this this morning.
Yeah.
So I'm out of practice.
That's where it throws me off when I do the mirror. It throws me backwards at that
Oh
point.
yeah,
I start going, wait, what did I do now? Right? I think that's what really throws me off of that. So,
Yeah.
All right, Dr. Keiser, thanks for coming on with it. We appreciate it. You've been watching What You Need to Know with Dr. Philip Keiser. I'm TJ Alls, I-45.